Thank you.
Hi, Tribe. Chelsea here with Tribe RN. I want to introduce you to Pamela. She's going to talk to us about dialysis nursing. So welcome, Pamela.
Hi, thank you very much. Hello.
So I'm super excited to have Pamela on today. I have to confess that she came on looking all beautiful, and I was like, wait, let me go get some lipstick. So there you have it. I'm trying to compete. So we got several questions submitted from viewers interested in dialysis nursing. So you're just going to give us a little bit of information and tell us what you know. What did you do prior, and how did you feel like it prepared you for dialysis?
So I started my nursing career right out of nursing school in dialysis. I started in a clinic. I worked there for a couple of years. Felt that I wanted more of a hospital experience, that I needed to gain more knowledge. I felt kind of stagnant in the clinic. So I left and I did pediatric nursing. And then after that, I went to the ER. Loved it, but my heart was still with dialysis. So when I got the opportunity to join the acute team for the company that I started with, I had to jump at the chance because acute dialysis was always the place to be for the top nurses, top techs. It was the place to be. So I feel that the peds nursing, the hospital nursing, the ER nursing really helped me with my time management skills and more patient care skills to carry on to acutes, where we dialyze in the hospitals and SNFs and such.
Okay, that's awesome. I didn't realize that you did ER and peds. That's great. So those of you that are tuning in, thank you for tuning in. If you have questions, just put them in the comments, and as I feel like they're applicable to our conversation, I'll ask Pamela at that time. So do you feel like dialysis in general is a good place for a new grad to start?
Absolutely. I do feel that it's better for them to start in a clinic, though. They have more time to teach a new nurse, a new dialysis nurse, dialysis. I feel it's very specialized. You go through quite a bit of training to become a dialysis nurse. I feel that right out of nursing school is the best time to get some of our nurses. You don't have all the bad habits to break in clinic. And then moving on up into acutes, I feel is the best route to go for new grads. And we need nurses. We need good nurses. And the new grads, they're just so eager to learn, and they're so eager to get in there and do what they need to do to take care of the patients. I feel it's great for new grads.
That's awesome. So I'll do a little bit of education. When you say clinics, you're talking more about the chronic, consistent dialysis patients, right?
Yes, the chronic clinics, that's where they're going to go for their 3 days a week, 3 to 5 hour treatments. You're going to get to know them. You're going to get familiar with their prescriptions. That's where they go for, I guess you could say, their maintenance dialysis.
So that's a good setting for a new grad. That makes a lot of sense.
Absolutely.
Can you talk a little bit about what the different dialysis jobs are like? So you mentioned clinic, you mentioned acutes. Can you explain a little bit to newbies what exactly the difference is?
Sure. Chronics is your outpatient clinics where they come in at their certain set times, 3 days a week, whether it's Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday. They receive their treatment in their chair. They're very territorial over their chair.
That's
yeah. I mean, it's one of the only things they can control. So they definitely control their chair, their area, their time. So you're going to see the same patients over and over throughout the week. You're going to get to know them very well. It's, like I said, Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday. They go for 3 to 5 hours. They have a doctor that comes to the clinic or a nurse practitioner that comes to the clinic sometimes once a week, maybe a little more, just to check in with them. You have a team of nurses, a dietitian, a social worker, and then you have your techs that work there as well. That's pretty much how it is in the clinic or in what we call chronics. In acute, you have your patients that are in for surgeries or something not related to dialysis. You also have your non-compliant patients, which they've missed several treatments or one treatment. Their potassium's high, they're fluid overloaded, they can't breathe. You're going to be dialyzing them. Excuse me. And then you also have your overdose patients that need dialysis to clear their system because they're in AKI or whatever reason. And then you also have like your CRRT patients where they can't tolerate the hemodialysis and it's a slower pull on them for fluids or cleaning them out, and it's gentler on them. So that's really what acutes is. It's kind of emergent. We run one of the areas like it's almost like a chronics. You get the same people over and over because they're not compliant or because they can't go to a clinic because they've been kicked out for whatever reason. So that's pretty much what acutes is.
Okay. Awesome. So what's the training process like for a new nurse, whether they are a new grad or an experienced nurse coming into dialysis?
So for a new grad or even experienced, if you have never done dialysis before, it's with the company I work at, I can't speak for everyone, it's a 6-month training. So for the first 3 months, you're doing like book work. Every now and then you get to go onto the floor to string the machines, set them up. You start learning the anatomy of the kidneys, the process of renal failure, the reasons why we dialyze, and our water system, which is a huge thing for dialysis. You have to have perfect water just to dialyze. So you learn as a tech first. The process is you learn to be a tech first, and then you pretty much earn your nursing then. You have to be able to do everything that a dialysis tech does, from opening the clinic or opening wherever you're at, like in acutes, opening your unit and testing the water, making sure it's safe, setting up the machine. You learn from then on. And then after your 3 months and you've tested, then you can start incorporating your nursing. You're working on the floor more. You're with a preceptor. You're never alone. And there's a lot of resources and there's a lot of nurses and techs that are going to help you out. We don't want you to fail. And I don't know what it's like for other states. In New Mexico, dialysis nurses and techs are governed by the Board of Nursing. So we have to go through a bunch of tests, certifications, and fulfill certain hours just for the training to be considered dialysis nurse or dialysis technician.
Oh, wow. So do you have to have the certification prior to practicing as a dialysis nurse?
No, you don't. So to practice as a dialysis nurse, you just have to go through the mandatory training, which is a paid training that most of the companies pay you to do. They invest in you.
Okay, so I'll just lead in nicely to the question itself. Is there a certification specific to your field? And if you've taken it, how did you prepare? How would you advise others to prepare for it?
There are 2 certifications for dialysis nurses. One is a certified dialysis nurse or a CDN. You have to have 2,000 hours within 2 years of dialysis nursing or nephrology nursing, and then so many CEUs to obtain it. And it's through, oh, what is the name of it? The Nephrology Nursing Certification Commission. I do not have my certifications yet. It's something that I am looking into studying for. I just can't decide whether it's the certified dialysis nurse that I want to do or the other, which is the certified nephrology nursing, which is 3,000 hours of nephrology or dialysis nursing within 3 years. I highly suggest using their website, though, as a resource.
Awesome. Okay. Nicole asked, are you trained in all aspects of dialysis, or do you personally specialize in one, PD, CRRT, or hemo?
I do mainly hemo. However, I am trained in PD and CRRT. I do PD and CRRT almost on a daily basis. In the chronic centers, you're going to be doing mostly hemodialysis unless you're in the home hemodialysis units where they teach the PD. But I do everything. I'm trained for all modalities, ranging from newborn babies up to 90 plus years old.
Awesome. So can you give us a picture of what a typical day looks like for you?
Oh boy. So we receive our assignments in acutes the night before. We're told what patients we have, what location we're going to. When we come in the morning, it's around 6 a.m. If we have a tech, the tech has been there about an hour before us, has set up the water system, tested our water to make sure it's safe to run, has our machine set up, we check the orders. If we don't have a tech, we go in, we check the water ourselves, we start it running, we set up our machines, test the machines, make sure they're safe to run, check orders, call report, get report from the patient's nurse from that night or morning, depending on when their shifts are. And then once we get the patient, we connect them, we start their treatment, and then we monitor them for the duration of their treatment, however long it is, however many patients we have, and then we start all over again for our second shift. Once we're done with that, what we're going to do is return the patients to their room, start rinsing our machine, disinfecting it, closing everything out, making sure our water is okay still once we shut it down. We're constantly in communication with the providers, the other nurses, letting them know how their patient's doing, asking, what needs to be done, any changes. I'm sorry. Acute nurses, we do have long shifts. I usually don't get home until around 8, 9 o'clock at night, sometimes later, depending on what's going on. If it's one of the nights that I'm at the hospital with the babies, then I don't go home until the baby is put on dialysis. And then I'm able to go home.
Okay. So patient to nurse assignment.
Patient to nurse assignment. If it's us by ourselves, then we have 2 patients. That's our company's policy. If we have a tech, I can take up to 4 patients. In chronics, it's different. I can't speak for what their nurse to patient ratio is anymore. When I was in chronics, it was 1 to 16 patients with 3 techs.
Oh, okay.
Yeah. Now in acutes, we can run a room, 8 patients with 2 nurses, 2 techs per shift.
Okay. Rosemary just had a comment. She said, hi, I graduated December 2018 and started an outpatient RN position in the hemo unit July 2018. I think she means she graduated in 2017. Correct me if I'm wrong, Rosemary. So I did have a question about, you said, let's talk a little bit about what does a stable dialysis patient look like? What are you watching for? What is your role as the nurse as you are monitoring these two patients?
It's going to be blood pressure, their mentation. You're going to watch for yawning. That's a sign of low blood pressure. Nausea, vomiting. You're just going to monitor their vital signs. We monitor them. If we're in ICU, running a patient at a bedside, we're monitoring them every 15 minutes. We don't leave them. There's always someone watching the patients, whether it's a nurse or a tech. In ICU, it's going to be a nurse, and they're one-to-one. So the other thing I'm looking for is cramping. Are they going to respond to me? If they're not responding to me, what is the reason? Is it blood pressure? Blood pressure is a huge thing in dialysis. We're messing with their fluid balance. Another thing is their heart rate. We're messing with electrolytes. We want to make sure that their heart rate's good, that they're regular, or if they're irregular, it's something that they came in with. We want them to leave better than what they've come into us. We don't want them to decline while they're dialyzing with us.
Mm-hmm. And as the nurse, is your role to monitor if the fluid ordered to be taken off is too much, then you as the dialysis nurse have to monitor that and say, we can't take that off, right?
Absolutely. We speak for our patients. There's times where the provider wants 4 kilos taken off and the patient comes in with soft blood pressures like 100/40 or whatever it is. And we have to assess whether the patient's going to tolerate such a large pool or not. And if they are, then maybe stepping things up or adjusting our machine to where we can pull that much off, or maybe we can decrease their fluid goal to be taken off. So maybe not 4 liters, but maybe 2 or 2.5, and maybe put them on what we call a profile, where you start off by pulling a lot, and then it takes less off later on, and then it comes back up to a lot. So there's so many things that we can change and adjust on our machines to where we can tailor a treatment specifically for a patient, where they're able to tolerate large pools. We're constantly adjusting.
And so just so everyone's understanding, and remember, we're talking to nurses that haven't even gotten out of nursing school yet. So those that are completely new to this stuff, we're not specifically or only taking off fluid. We're not only adjusting electrolytes. It's a full picture, right? So not only are you watching their labs and how they're tolerating the fluid pool, but your goal is to make their electrolytes stable, even if you can't pull off the fluid, right?
Absolutely. We're doing the work for them that their kidneys can't do, which is, for the new grads or the new nursing students, the kidneys do so much. They do fluid balance, blood pressure balance. They clean us out, like the toxins, the uremic acids. That's some of what dialysis does. What we're doing is doing the work for the kidneys that the kidneys can no longer do.
Awesome. So Colleen had asked, what are the hours like? I've heard horror stories of stressful 15-hour shifts and 50 hours or more a week.
Well, that's not entirely wrong. It is a day when you get out at 13, 14 hours. We go in and we do our 2 shifts in acutes. We don't leave until our last patient's done. Sometimes we do have a nurse that takes over. It is not bizarre to have a 15-hour day. They are long days. It's worth it. I feel it's worth it. 50-hour weeks, not as much. Not as much. We usually do 3 days a week, anywhere from 12 to 15 hours.
Okay. So what are the top 3 challenges in your area?
Oh my goodness. I would say the long work days, being short-staffed. We need dialysis nurses. We just need them. I think that dialysis is an increasing need among our American population. I really do. And then non-compliant patients, just like anywhere else, that's a challenge. Trying to re-educate them and remind them why they need dialysis so bad.
Yeah. So Tracy asks, any tips for nurses in long-term care whose alert and oriented patients keep refusing dialysis?
Yeah, it's going to be education. We, as dialysis nurses, we see a lot of things that can go wrong. The fluid overload, they're not going to be able to breathe. So one of my favorite things to do is to show them the 1-liter bags of saline and let them know that, you know, for every kilo that you are over your dry weight, that is 1 liter of fluid around your heart, your lungs. You're going to have difficulty breathing. Your heart's going to work even harder. The toxins are going to build up in your body, and that includes the phosphorus, which then causes calciphylaxis, and then that is your chance to inform, especially the young males, that the penises are affected first, and let them know, you know, they can always Google calciphylaxis of the groin and what that does to that area, and usually that helps out. Just document a way too. I mean, you can't force them. We don't know what it's like to be tied to that chair for the 3 to 5 hours, 3 days a week, and they get tired of it. They really do. Just educate them. And if that
Those are great
stories, then include them.
Yeah. Tara says, love Pam, best damn dialysis nurse I know.
Oh, I love her.
All right. So is it a high stress work environment?
It is, but it isn't. I don't feel that it's any more stressful than any other specialty or any other unit. I think that the high stress comes from the changes and the frustration with the patients, and maybe the long hours, or going in to your day and maybe not having orders. But we all experience that no matter what unit we're in.
Sure. Do you feel like you have a good relationship with your docs?
I do. I love most of my docs, as long as they're not adding on a bunch of patients. I do. I really like my docs. I can joke around with them. They have a good personality. I think every specialty has their own little quirks and personalities. Like neuro is a little weird. Not really. But neuro has their own personality. Nephrology has their own. And we just get each other. If you're working in that specialty, you just get them. And I think it's special. They come in, they say hi. You can vent to them, they vent to you. I appreciate my docs. I enjoy working with who I work with.
And it sounds like it's a really pretty tight working order that you guys have to be in, just knowing your doc and knowing that they're okay with you making the changes that you need to make in order for the patient to be safe.
Absolutely. It's a trust issue. It's a trust thing with them. They have to be able to trust you. They have to be able to count on you and know that you know what you're doing and that you're looking out for the patient, because sometimes a lab changes and they depend on you to recognize that and decide, where their prescription needs to go then. And with accesses, they depend on the nurses and the techs so much.
Yeah, that's awesome that you have a good relationship. So how do you decompress after a stressful shift? Are there resources available to you?
So as far as resources, like with our company, not much. I mean, it's as with anywhere else, they don't really provide you with spa days. But I do come home, I hang out with my family, hang out with my dogs, my animals. I mean, it's just what I enjoy doing personally that helps me decompress. And my husband gives me like 15 minutes to talk about work and then no more.
Oh, that's good advice. I like that. Sharon said, I agree regarding the stress. I enjoyed working in dialysis.
Oh, yeah.
So what do you think makes a nurse successful in dialysis in general?
So it's going to be time management, flexibility. You need to be confident, but you also need to be humble. You need to respect your techs because they are what make or break you in dialysis. You all depend on each other so much. And techs, especially in chronics, they're going to know more about your patient than the nurses because they spend so much time with them. They take care of 4 to 5 patients, whereas you take care of 10 to 16 or however many in chronics. And they're going to know more about your patients. In acutes, it's just about the same thing. The techs are going to be walking around more while we're doing our nurse duties and our paperwork and our charting. So you really need to respect them. Another thing is going to be, you need to be flexible. You need to be able to have the backbone to tell the doctor, I don't feel this is the appropriate prescription for this patient. I don't feel that this patient is stable. I think we really need to rethink the modality, or maybe it's a PD patient that's going south or really isn't all there mentally and doesn't have the support at home to continue with PD. You need to be able to have the guts to tell the doctor, this is how I feel and this is why. And
those are
time management, huge.
So can you describe, since you mentioned PD again, I realized that we kind of brushed over it earlier and didn't really say a whole lot about it. Can you explain peritoneal dialysis just a little bit so that people that are unfamiliar would understand?
So hemodialysis is where we take the blood outside the body. We put it through an artificial kidney, through a machine. We clean the blood, pull off extra fluid, replace electrolytes, we balance them out. Peritoneal dialysis is all within the belly. So everything that we're doing, most of what we're doing on the machine is now being done within the belly. It's not so much on a machine. The peritoneal cavity is what's cleaning balancing the fluid, cleaning the uremia out. It's taking off extra fluid. It's all done within the belly, whereas hemo is with the machine and dialyzer and the artificial access or the fistula.
Awesome. So what's your favorite tip or trick for dialysis in general?
That is a hard question. I saw that on the list and I didn't even know what to think. I think one of the biggest things is to always triple check your orders. Our machines are already preset to 3 hours and 3,000 milliliters to pull off. That is something that when you see your auto-programmed numbers, that's when you really need to double check. You should always double, triple check your orders in dialysis.
Okay, good. What do you love most?
I'm sorry?
What do you love most?
What do I love most? I love the autonomy of dialysis. I love most of my coworkers. I love seeing a patient improve. I love being able to see a difference in mentation once you've pulled off extra fluid or you've gotten their electrolytes balanced, where they wake up and they start talking to you and you just see a definite difference from beginning of treatment to end.
And how often do you have a critical situation where you're coding or doing anything like that?
Lately, it's been a little too often.
Okay.
Yeah, I don't know what it's been. I've had to code 2 patients in the last 3 weeks, and that's been an eye-opener for me as to how critical our job as a dialysis nurse is. But it's not very often. I've been back in dialysis for almost a year and I've only had 2 codes. We've had people where their blood pressures drop and you have to act immediately, but critical situations, not very often.
That's good. So what's the hardest part of your job?
Oh, the hardest part of my job is seeing the young adults come in with hepatorenal failure because of alcohol use, and then seeing that they have children, and it's like, what kind of example are you setting for your children right now? And then losing them. I haven't seen many of them live very long after the hepatorenal failure, and just seeing how now these kids have lost their parents because of alcohol. Another hard part is knowing that dialysis isn't a cure, that it's just going to prolong someone's life, and knowing that these memories that they're now creating with their family while they're on dialysis is the whole reason we're dialyzing them. Also having the babies and the little kids and on dialysis, and knowing that this may be the rest of their life if they don't get a transplant, or maybe this is their life because their parents chose drugs, and that's the difficult part of my job.
For sure. How often do your patients get transplants?
I can't really answer that. We don't really do a lot of transplant patients. In the hospital, we'll see them every now and then. I think I've personally dialyzed maybe 4 in the last 6 months. We do have patients where they're on the transplant list, or one has, has had to leave the state hoping that he would get a transplant, and just to get out there and somebody got it before him. Yeah.
That's hard. I've got a few comments that came through. Safa said, great information. Thank you so much. And Tamara said, patients love Pam. She goes above and beyond. She even does ballet for them.
Oh, I do. Who said that? Tara. Yes, I do a ballet dance. They tell me I shouldn't quit my nursing job, though.
That's amazing. I saw a video of a different country. I can't even remember where it was. Spain, maybe, where their dialysis unit was like dancing. Did you see that floating around?
Yeah. I had somebody tag me in that video, and I was like, oh yeah, that's kind of how I dance for my patients, and I sing. Awesome. And like I have a horrible voice for singing, and I'm a big girl. I don't dance very well, but I do it anyway, just make them smile and laugh.
I love that. Well, thank you for giving us your time. Guys, if you have any more questions for Pamela, just get them in the comments, and I'm sure she'll be happy to answer them after the fact.
Absolutely. Absolutely.
Thanks for giving us your time on your day off, Pamela. Thank you, thank you, thank you.
Thank you so much, Chelsea. Have a good night.
Someone asked a question, sorry. What's the expected average lifespan once dialysis starts if no transplant is received?
I think it's dependent on the patient's compliance and how well that they take care of themselves. I have seen patients last a couple of years, and I have known patients that they've been on dialysis 20 years. So it's just dependent on the patient and how well they're going to take care of themselves and adhere to it, plus their comorbidities. So there's not one standard answer for that.
That makes sense. I don't know who this was. Sharon said, I did hemo-PD transplant prep while working. It was quite interesting. So,
absolutely. Dialysis is very interesting. I see that, you know, once you've started in dialysis, no matter where you go, you always come back. And everyone says that. Everyone that I know in dialysis says that.
Oh, interesting. That's awesome. Well, thank you again for your time, and any other questions, you guys just get them in the comments and Pamela will answer. Thank you again.
You're welcome. Thank you so much.
Good night.